when talking about first aid and evaluating your animal, I encourage everyone to look at their animals when they're not sick and when they're healthy, so you kind of know what normal for them is. The first thing to consider is, you should be familiar with the normal vital signs such as temperature, pulse, and respiration. So normal temperature for a dog or a cat is 99.5 to 102.5. And some animals will run differently, so some can run cooler, some can run hotter, just as much as in humans. Second thing is heart rate. A normal heart rate for an animal, and this will vary between sizes of animals. A bigger dog will have a slower heart rate than a small dog. But usually the average is 80 to 120 beats per minute. And then respiration is usually about 15 to 30 breaths per minute. Of course, when an animal's panting, that's a little bit different, so that's not an accurate evaluation. Whenever you are suspecting your animal may be sick, always do an evaluation and once again know what your animal looks like normally. So when I'm doing an evaluation on an animal in the exam room, I always start from head to toe. First thing I look at is mucous membranes, and animals will differ in the colors normally. So in Rusty's case, in most animals' case, it's usually pink. So the normal in this case we want to see is pink. The capillary refill time is the time it actually takes when you press on the skin for the blood to come back in. That should be less than 2 seconds, and then the mucous membrane should always be moist. So any variation from that can indicate different conditions. You can also look at the sclera of the eye, which is the white of the eyeball, if your animal will let you. And that should normally be white and not bloodshot or yellow in the case of an illness. You don't always evaluate your animal for lumps or bumps or anything. So you'll know if there's something that's all of a sudden popped up, because a lot of times I'll see tumors on animals come in and the owner will say, "Oh, gosh, it just came up yesterday, but I know it's probably been there for a couple months," just because, and everyone's guilty of this, but you probably don't always run your hand down their body to check for things. So it's just a good idea to evaluate them once in a while. To take a pulse, to check heart rate, a couple things you can do. I always encourage everyone to purchase a stethoscope, much as I have here. These range in price from $15 all the way up to $200 to $300. So depending on what your goals are, you can find one to fit your needs. So in order to listen to the heart of a dog or cat, always listen on the left side under the armpit here, and just practice this, because sometimes it does take a lot of time to figure out where it is. When you're counting the heart rate, just watch the clock, count 15 seconds or 15 seconds, and take that number you get times 4. That'll save you a little bit of time, so you don't have to sit there for a full minute, because as you can see, animals don't always like to sit still, do they? If you don't have a stethoscope, you can also listen to the heart rate directly over the chest of your animal, or other easier way is to actually take the femoral pulse, which the femoral artery is located on the inside of the thigh here, just right next to the body wall. So I'll show you that a little bit closer. And when you're taking that, just go all the way up into that little area there. Just push all the way up to the elbow, kind of like there, and you can feel it. I'm feeling about this big of an area on my fingers, and you just go back and forth until you feel the pulse, and once again count for 15 seconds and take the number you find times 4. So hopefully everyone will go do that and look at their animals when they're healthy, and we'll know if they're actually sick. So we already talked about the normal patient assessment, so once again I encourage everyone to look at their animal when they're normal. So if you have a situation where you are having an emergency and you think that you may have to do CPR, or you're going to make a call to your vet, you need to be able to assess these animals and maybe have just a little bit of an idea of what's going on, so you can paint a better picture for the person on the other end of the phone, and kind of also know the prognosis. We talked about looking at gum or mucous membrane color, which is your gums. They should be pink and pink moist and have a capillary refill time of 2 seconds. Other things that we can see, or you can see, not normally but abnormally, they can be pale, pale white, which can indicate either internal bleeding, shock, or external blood loss. Sometimes we see yellow mucous membranes, and also when we talk about the sclera here, we can also see yellow whites around the eyes. That's also, it can go hand in hand with the mucous membranes. Yellow typically indicates liver dysfunction. It can also indicate immune-mediated hemolytic anemia, which is an immune-mediated disease of dogs that we commonly see. Brown mucous membranes, we see this in cats, especially when they have Tylenol toxicity, and also in a dog that has ingested too much Tylenol. So we recommend also staying away from Tylenol in animals. Next thing to look at is the overall demeanor of your animal. Animals should typically be bright, alert, and responsive, and be aware of the surroundings, and just be happy and be a happy golden retriever such as Rusty here. Some variations from normal on that is what they can be untunded, which means they're not quite aware of their surroundings. They're still awake, but maybe just kind of confused. They can be in a stupor, which means they have to actually be aroused from being asleep, and then if you let them go, they'll go back to sleep. And then in a coma, that's probably the worst prognosis. That means they can't be aroused, and that can mean they're very ill, or sometimes we can actually see that after a seizure where they're for maybe 2 hours afterwards they're actually not aware of the surroundings and can't be aroused. So those are two things. Other thing to think about is rapid heart rate. Usually that's associated with shock, pain, or blood loss. A slow heart rate is also something to be concerned with. That can be associated with a condition called Addison's disease, where they have electrolyte imbalances. Also with brain swelling, especially in the case if your animal gets hit by a car and they have a slow heart rate, a lot of times that indicates brain swelling, which does indicate a pretty poor prognosis for them. And just also look at their breathing. Rapid breathing, panting can be normal, depending on the situation. But if it's if you see an abdominal component where they're actually really having a hard time breathing, can indicate cardiac dysfunction, fluid on the lungs, just a number of different things. So just kind of be aware of any abnormalities, and hopefully this gives you a little bit of a background on maybe what could be going on.